Is PGD an option for cystic fibrosis fertility? Imagine being able to have a biological child without passing on cystic fibrosis. Preimplantation genetic diagnosis, or PGD, makes this possible for many couples affected by the condition. PGD is a technique used alongside in vitro fertilization to screen embryos for genetic disorders before pregnancy begins. It involves taking a small number of cells from an early-stage embryo, usually on day 3 or at the blastocyst stage, and testing them for mutations in the CFTR gene, which causes cystic fibrosis. If the embryo is free of the disease-causing mutations, it can be selected for transfer into the uterus. This process helps reduce the chance of passing cystic fibrosis to the child, avoiding the need for invasive prenatal testing or difficult decisions later in pregnancy. Cystic fibrosis is an inherited disorder that affects the lungs, digestive system, and other organs. It is caused by mutations in the CFTR gene, which is inherited in an autosomal recessive pattern. This means a person needs 2 copies of the mutated gene to have the disease. Many males with cystic fibrosis are infertile because they are born without the vas deferens, the tube that carries sperm. This condition is called obstructive azoospermia. However, with PGD combined with in vitro fertilization and intracytoplasmic sperm injection, or ICSI, men with cystic fibrosis can still father biological children. ICSI involves injecting a single sperm directly into an egg, which can help fertilize the egg even if sperm are limited or absent in the ejaculate. Using PGD for cystic fibrosis involves creating embryos through IVF, then testing each embryo for CFTR mutations. Only embryos without the mutations are selected for transfer. This approach has been used successfully worldwide and is one of the most common reasons for PGD in cases of inherited single-gene disorders. Success rates vary depending on many factors, including the woman's age and overall health, but many couples have achieved healthy pregnancies and births using this method. PGD also reduces the emotional stress associated with prenatal diagnosis and the difficult decisions that can follow if a fetus is found to have cystic fibrosis. It minimizes the risks linked to invasive prenatal testing procedures like amniocentesis or chorionic villus sampling, which carry small but real risks of miscarriage. From the perspective of people living with cystic fibrosis and wanting to start a family, PGD offers a valuable option. It addresses both the genetic risk of passing on the disease and the infertility challenges that may come with CF. While it does requiring medical expertise, counseling, and sometimes significant financial resources, it provides a way to conceive a biological child without cystic fibrosis. It is important to remember that each person's situation is unique, and decisions about fertility and genetic testing should always involve consultation with fertility specialists and genetic counselors. In summary, PGD is a well-established, scientifically supported option for individuals and couples affected by cystic fibrosis who wish to have children without passing on the disease. It is typically performed in conjunction with IVF and offers a way to reduce the risk of genetic transmission while overcoming infertility issues related to CF. For anyone considering this route, speaking with healthcare professionals can help determine the best approach based on personal health, family history, and individual goals.